Assalamu alaikum. Hope everyone is fine by the grace of Almighty Allah. Today we're going to discuss about introduction and causes of cancer. Cancer basically, that's a Greek word and refer to the claw-like blood vessel extending over the surface of an advanced breast cancer. Theories do exist regarding cancer that move from divine intervention on now are firmly based on the cellular region of cancer. Hippocrates used the Greek word carcinos and carcinoma to describe tumor, thus calling cancer as carcinous tumor. The world's oldest documented case of cancer was found in Egyptian mummies from 1500 before Christ, and it was even found in fossils of dinosaurs. So if you just go into brief history, Rudolf Virchow was the one who described that a cancer is a disease that arises from certain cells, and it was encapsulated by his famous dictum "Omnis cellula e cellula", that means every cell arises from a cell. While Theodore Boveri in 1914 showed the importance of chromosomal abnormalities in cancer cells, while DNA was identified as a genetic material within the chromosomes in 1940 by Oswald, while Watson and Crick in 1953 described the structure of DNA, and this discovery was the key that paved the way for the study of molecular biology of cancer. So, how are the cancer cells? Basically, they are psychopath. They are called as psychopath because they have no respect for the rights of other cells. They violate the democratic principles of normal cellular organization. Their proliferation is uncontrolled and their ability to spread is unbounded. Their inexorable, relentless progress destroys first the tissue and then the host. The cells that require malignant transformation, they have typical features before getting malignant transformation, and one of the most important is they establish an autonomous lineage. Basically, this involved developing independence from the normal signals that control supply and demand. Cancer cells usually escape from the normal system of check and balance. They grow and proliferate in the absence of external stimuli. They proliferate and grow despite signal telling them not to do that. Oncogenes are the key factors in this process. The cancer cell, they obtain replicative immortality. Normal cells in human body, they have permitted to undergo a finite number of divisions. Normally it's around 40 to 60 divisions, and this limitation is imposed by progressive shortening of the chromosome at the telomere end, with that result after each division. But in cancer cell, the telomeric ending is not being shortened because they produce telomerase enzyme that rebuild the telomeric end. So for the cancer cells, the clock has never been clicked and they just continue to replicate and got immortality. They also got the ability to evade apoptosis. You all know that apoptosis is a form of programmed cell death. And certain genes like p53 that act as a tumor suppressor genes, if there is any modification into these genes, the normal apoptosis process is blocked. Cancer cells will be able to evade apoptosis, which means that the wrong cell can be in the wrong place at the wrong time. They acquire antigenic competence. A normal cell mass cannot grow beyond 1 millimeter in the absence of a good blood supply. But the tumor cell, they got the ability to form blood vessels. Their ability is termed as angiogenic competence, and this is a key feature of lignin transformation and development of cancer, and particularly its progression. The cancer cell acquire the ability to invade. Cancer cell, they do breach the basement membrane and thus gain direct access to blood vessels and lymphatics. How they can do it? There are three main mechanisms to facilitate invasion. They cause a rise in interstitial pressure within the tissue. They secrete certain enzymes like collagenases and proteases that dissolve extracellular matrix, and they acquire motility. They also got ability to disseminate and implant. When they can breach the basement membrane and got access to the blood vessels and lymphatics, of course they can spread to the rest of the body, getting access to uh, vascular and lymphatic systems. They also need to acquire the ability to implant. Cancer cells probably implant themselves in distant tissues by exploiting and subverting the normal inflammatory response. They do have another characteristic, that is evade detection and elimination. Basically, the cancer cell do pose themselves as self and not self. So cancer cell, or at least those that give rise to a clinical disease, appear to gain the ability to escape detection by the normal immune system. There is another term used for the malignant transformation of cancer cells, that's jettison excess baggage. Cancer cells are geared to excessive and remorseless proliferation. They do not need to develop or retain their specialized functions that make them good cellular citizens. They can therefore afford to repress or permanently lose those genes that control those functions. This can leave cancer cell vulnerable to external stresses and may in part explain why some cancer treatment do work. The other strategy is subvert communication to and from the cancer cellular environment. Providing false information is a classical military tactics. Degrading the command and control system of the enemy is an essential component of modern warfare. Cancer cells almost certainly use similar tactics in their battle for control over the host. Given the complexity of communication between and within cells, this is not an easy statement either to prove or disapprove. They develop ability to change energy metabolism. Blood flow is mandatory for the progression of any disease, particularly the cancer cells. The cancer cells they do modify themselves to survive in a state of relative hypoxia. This change in energy metabolism compared with the corresponding normal tissue, some cancer cells may be better able to survive in hypoxic conditions. For the cancer growth, they typically follow Gompertzian curve. According to this, before the cancer become clinically detectable, they have exponential growth, and after that, their growth becomes slow. So, what is the implication of Gompertzian curve? According to it, the majority of the growth of a tumor occur before it's clinically detectable. By the time they are detected, tumors have passed the period of most rapid growth, that period when they might be most sensitive to anti-proliferative drugs. There has been plenty of time before diagnosis for individuals have to detach, invade, implant, and form distant metastasis. So now we are going to discuss about causes of cancer. Both inheritance and environmental factors are important determinants of cancer development. Domesticity, claiming that cancer is largely a random process, just a bad luck, because a normal gene, they are sitting in our system. When they got modified, like p53 genes, if it got modified, the tumor suppressor gene, the cancer cell become more proliferative as compared to normal genes. Wu, Powers and his colleagues describe that extrinsic factors make a substantial contribution to the development of cancer. So if you just go into brief description, environmental factors play around 90 to 95% role in development of cancer. Out of them, 35% it would be around diet, tobacco would be 30%, sunlight around 10%, some other factor would be around 10%, viruses play around in 7% of cases, occupational factor, alcohol, other contributing factors. So if we just discuss about certain inherited syndromes and leading to cancer formation, the well-known phenomena is familial adenomatous polyposis syndrome with implicated gene known as APC genes. And due to this APC gene modification, colorectal cancer, usually under age 25, papillary carcinoma of the thyroid, cancer of ampulla vater, hepatoblastoma, and certain other cancers are well documented. Some other inherited syndrome like hereditary non-polyposis colorectal cancer, causing colorectal cancer typically in 40s and 50s, and some other syndromes like Peutz-Jeghers syndrome, Cowden syndrome, retinoblastomas, multiple endocrine neoplasia type 1, type 2. That's typical involvement of menin RET genes causing parathyroid tumors, islet cell tumors, Pachy tumor in men type 1, while in men type 2A, medullary carcinoma of the thyroid, pheochromocytoma, and parathyroid tumors are well documented. Similarly, Li-Fraumeni syndrome and familial breast cancer with particular implication of BRCA1 gene and BRCA2 gene causing breast cancer, ovarian cancer, papillary serous carcinoma of the peritoneum, and prostate cancer are well documented. Certain other inherited syndromes like familial cutaneous malignant melanoma causing skin cancer, basal cell nevus syndrome causing basal cell carcinoma, von Hippel-Lindau syndrome, neurofibromatosis type 1 and type 2, xeroderma pigmentosum causing certain type of cancers. So if we just discuss about some environmental factors of cancer, the leading cause is tobacco, causing mainly lung cancer, but other head and neck cancer are also documented. The second most leading cause, particularly in Western countries, is alcohol, that causing esophageal cancer and liver cancer. Ultraviolet exposure causing melanoma and non-melanoma skin cancer, while ionizing radiation leading to leukemia, breast cancer, lymphoma, and thyroid cancer. Certain viral infections do cause certain type of cancers like human papillomavirus causing cervical cancer and penile tumors, HIV causing Kaposi sarcoma, lymphomas and germ cell tumors, while hepatitis B implicated with hepatoma formation. Some other infections like bilharzia causing bladder cancer and H. pylori causing stomach cancer. Some inhaled particles, particularly asbestosis, leading to mesothelioma, and wood dust causing paranasal sinus cancer. Some other chemicals like being used in industry and medical profession are causing certain type of cancers like vinyl chloride causing angiosarcoma, aniline dye that's being used in the rubber industry is causing bladder cancer, and nickel and arsenic causing lung, nasal cavity cancer, and skin cancers. Similarly, some alkylating agents being used in medical therapy causing leukemia, lymphoma, lung cancer. Immunosuppressive treatment leading to Kaposi sarcoma, and tamoxifen used for the breast cancer leading to endometrial cancer. Some fungal and plant toxin like aflatoxin but well known for the development of hepatomas. Obesity and lack of physical exercise leading to breast, endometrial, kidney, colon, and esophageal cancer. Thank you very much. If you have any question, you can just please mention in the comments. Thank you very much.